tips to help you prosper in your exams and make you the best nurse, the best doctor, the best PA, the best nursing student you can be. Welcome back. So today I'm talking to my students. Whether you're in nursing school, you're in any program, medical school, it doesn't matter. Nurse practitioner school, this video is for you. So if you watched my previous videos or if you're just joining me for the first time today, my name is Claudine. I am a doctorally prepared nurse practitioner and I am dual certified in both acute care and psychiatry. So as you can imagine, I've gone through several classes, several courses to get me to where I am today. And I thought, why not share the pearls that I've learned all throughout my career and throughout my educational process. And that's why I wanted to come on here. And you're probably struggling and you're just wondering, how can I pass my exams? So I have top 10 tips for you that can help you get those A's or B's that you're looking for and to move you all the way from your E's, your D's, and even your failing classes. This is actually a very good time because you are in the middle of the semester and this is the time you're trying to wonder, am I going to pass that exam? Am I going to be able to move on to the next level? So if that's you, or even if you're just wondering, how can I improve on my grades? Then stay tuned. Make sure you watch this till the end because I have very important points for you. The first thing is understand the exam format. If you've gone through different classes, you probably know like there's select all that apply, there's case studies, there's self-written answers, there's ABCD choices. So one thing is to make sure you understand the format. Number two is create a study plan. I had my study plan. Even up to now, I still use study plans, but I use them for different reasons. So having a study plan helps you manage your time well. So it helps you know which exams are coming, which ones do you need to prioritize, which schedule do you need to go by. And this study plan is not only for school, it also incorporates other things like your social life, your other events that you need to attend, your family events, your work. If you're going to school and you're working, yes, that those who work full-time and still go to school. So this study plan will help you with that. And right now there's a lot of templates that can be utilized, especially if you're studying for something in particular. Let's take an example of nursing classes. So you're probably studying on electrolytes. Let's take hyperkalemia. You have it on there, you have your values, you have a specific area that tells you causes, how to fix it, and the potential complications. So study plan templates are very useful and I would definitely recommend for you to get one if you don't have them, or if this is an option for you. And some people may even improve in their studies when they write things down. So this study plan is very easy to use and you can take it with you whichever place you go to and can review your writing or your studies at whichever point you are. The third thing is use reliable study resources. There's a lot of study resources out there. There's YouTube videos, there's study guides, there's websites that you can use. Make sure whichever website you use is valid. Right now everybody's out to make money and some people might put out information that's not valid or not even up to date. Research continues on a daily basis and all the study guides are always being updated. So make sure that whichever one you're using is up to date and is valid. The fourth thing is practice style questions. If you're in nursing school, something you need to do is study NCLEX style questions because this helps you prepare yourself, and that's really what most schools utilize because they're preparing you not just for your career, but they're also preparing you for passing your NCLEX. So make sure you study NCLEX style questions. Number 5 is focus on critical thinking. Yes, don't just look at something straightforward. Look at it as outside the box as well. Always practice critical thinking. Like if I do A and B, how about C? If I do C and D, how about A? So always open your mind to critical thinking and to learning more about what you need to learn, what you need to do, and what you can do to improve the current situation. Number 6 is master medical terminology and pharmacology. So there's no way around this. You really just have to know. For example, know the common drugs, the side effects, the common uses, interventions in terms of medications. There's no way around it. Another thing is like lab values. Lab values are just standard. You don't make your own. You have to really master the specific ones. So that's number 6. Number 7 is use mnemonics and study aids. So for example, Mona. Mona is something commonly used when taking care of somebody suspected to have a heart attack or treating somebody with heart attack. So Mona for morphine, oxygen, nitroglycerin, and aspirin. So that's something commonly used. So these are things that you can memorize to help you get through your studies or even get through your clinical experience. Number 8 is review lab values and procedures. This is, as I said, there's no way around it. You just have to know them. So let's say something like glucose, 69 to 99 for normal. That's the standard. There's no way around it. Something like potassium, calcium, lipid panels. Those are things you have to memorize. Their lab values. And certain procedures as well. Inserting an IV, inserting a Foley catheter, removing an IV. There's no way around them. You have to really know the process, because when you go for your test out, the instructor is going to want you to show him or her how you do it. And there's always like a guide on step by step what you really need to do. There's no way around them. So you really just have to memorize this. Number 9 is take care of yourself. I can preach the whole day about this. So things like getting enough sleep, eating well, staying hydrated before and even after your exam. This is very important to help you prosper, to help you answer your questions the right way. And if you feel that things are overwhelming for you, we can talk about that in number 10, which is managing exam anxiety. Things like you need to just slow down and take a deep breath. Read the questions slowly and carefully and trust your knowledge. Have you always heard of people saying that when you go back to change an answer, you are changing the correct one into a wrong one? And that always happens most of the time. So make sure you manage exam anxiety in a way. If you need accommodation for whichever reason, don't hesitate to ask your instructors, to ask your provider to write your letter so you can get accommodation. Because some people they don't do well in crowds. And sometimes when others start walking out of the exam room, it makes them feel like, oh, I'm still sitting here, I'm not done yet. So I'm probably not doing it the right way. So make sure you manage exam anxiety well. And good luck with everything. I hope this video has been helpful to you, and I hope you can utilize, if not all of this, a majority of these tips to help you prosper in your exams and make you the best nurse, the best doctor, the best PA, the best nursing student you can be. Until next time, peace out.